Hello, my name is Adam Rohr, and I did the country of Nigeria with my partner Mikhail Stevens. The first part that we come to is epidemiology, and the first statistics that we have is the cases, deaths, recovered, and active cases. Cases in all that have happened is 57,613. Death is 1,100. Recovered is 48,836, and active cases there are about 7,677. So the population adjusted estimates look around 23,369,520. And any trends in cases, deaths over time, there was a big spike on July 1st of about 790 new cases, and on June 16th there was a spike of 31 deaths. This is part 2 of the point 1. It's excess mortality estimates. They're about 445,481, and that is based on the whole population of Nigeria. And as many of these statistics as you can find broken down by age, gender, race, or comorbidities. Well, there wasn't really much research to do on this one. The only thing I found was there's 10% of all cases in Nigeria are under the age of 19. It seems like they don't update their stuff very often, so there was no charts, nothing anywhere really, other than just a big headline of a news report that said 10% of all cases in Nigeria are under the age of 19. That brings us to medical and public health. So what is the cost sharing scenario? Who's paying for it? Is healthcare universal, available, affordable? The answer to that is no, it's not very affordable. The healthcare situation is very bad in Nigeria. Over 90% of all of Nigeria's population is without healthcare. That is crazy to think about. There was a launch by NHIS in 2005 that only covers under 10% of Nigeria's population. Even with that big launch, it only covered under 10%. That makes the vulnerable spots and the low-income spots in Nigeria not able to afford healthcare. So the overall healthcare, just in a summary, is the quality of it is very poor, and it is in desperate need of social health protection. So personal and facilities required to care for COVID and other patients. So it said there are roughly 3,534 hospitals in Nigeria, and that was based off of 2014's statistics. Because, again, it seems like they do not update their stats very much. In 2015, there were reported 100,000 hospital beds. In ICU beds, there were 1,420. Ventilators right now, they're under 100 functional. So access to basic medications. There are a lot of manufacturers in Nigeria that have quality medicine, but there have been several problems with the medications being abused of drug use. But the federal government is tackling those issues right now. And they state that the Nigerians have access to safe pharmacy products. That's what they state. Who knows? Part 2 of that is PPE supply for healthcare workers. So Nigeria, they based a lot of their supplies on imports. But right now, they can't really do that, so they have relied on private corporations working with suppliers. They've had to go to a name brand, Tiffany Amber, and by early June, there has been 500 cloth masks, 10,000 scrubs, 15,000 patient gowns, and 10,000 surgical gowns produced. Availability of COVID testing in labs for analysts. 2,500 samples a day, and there are about 5 labs in Nigeria where people can test for COVID. Contact tracing capacity and efforts. There are over 9,000 contacts of confirmed cases. Quality of reporting is not good. Not good at all. Nigeria was not ready for this this pandemic to hit, and they are not getting in all of the testing that they need. So the next point is mitigation response efforts and community response analysts. Government level policies and regulations like closures, shutdowns, travel restrictions, quarantine requirements, mask recommendations, etc. So the markets, there are no restrictions right now. Parks, gyms, and cinemas are at half capacity use, and masks are mandatory in public spaces. That has been in effect since April 27th. And Nigerians that are returning to Nigeria must be quarantined for 2 weeks. What were their timing relative to onset of cases in the country? So like I said, on April 27th, Nigeria's president put an overnight curfew from 8 p.m. to 6 a.m., and that is also when the mask became mandatory. On May 4th, there was a hold with some businesses commencing operations. Have they differed drastically in different regions of the country, or are they mostly the same everywhere? So they are mostly the same across the country. Most of the commands have been by the president of Nigeria, but most people have not actually listened. So it's kind of back and forth. Like, they all have the same requirements, but it's not the same in every city. So this brings us to part two of that, like I said. Have they changed over time? It hasn't been much change. Nigeria has been a hotspot for COVID, and there's very limited social distancing and few people being tested, like I said. The leadership is in denial, like they don't really think it's that big of a problem, even though the president has sent out these orders. Next is, how well have the recommended policies been accepted, adopted by the general population? Are there any specific cultural values or community attributes that might have impacted this? So the Nigerian citizens trust the government, but due to the lack of resources, it's leading to many more deaths, and that's not good. This brings us to our next topic, is health disparities highlighted by COVID and other social impacts of the pandemic. Are there specific subpopulations that have been heavily impacted relative to others? If so, what are some contributing factors? There has not been a heavy impacted subpopulation that have been impacted. Impact on the economy. Many events are being canceled, such as flights, religious gatherings. Nigeria's economy is facing collapse that largely depends on all of their exports. So they're not able to export, so their economy is kind of going downhill. Fuel prices fell and all markets are going down, and there are a lot of people being laid off of their jobs. Impact on education. The children in undeserved communities of Nigeria are being left behind, as they are not equipped to adapt or transition to the new methods of learning. Governmental reforms in the national curriculum would help bridge the gap in equality, as would PPS. So this is the part two, impact on other health issues. Nigeria currently only has a capacity of only 2,500 samples a day. This is a shortage of human resources, testing kits, and laboratories. There continues to be a rise of death in cases. The Nigerian government has taken numerous health, social, and economical measures to cushion the impact of COVID-19, but it's still a struggle. Unique factor about the country that you found compelling. So me and Mikhail, we found that the poverty level to be compelling, because we had no idea how rough that was. Evaluation and recommendations. What has gone wrong or right? Nigeria was not very well prepared for COVID-19. Due to lack of resources, many are dying at a large rate. What is the perceived level of effectiveness of the country's response? Nigeria was not ready to respond at all. They weren't prepared. The testing rates are low for COVID in the country. They can only have 2,500 tests a day. So that low amount of test, it might look like they don't have a lot of COVID like cases in their country, but they're only having 2,500 tests a day, so they can't get accurate numbers. They have a population of about 200 million. How well coordinated has the response been? The response has helped Nigeria curtail the spread of the virus, but Nigeria as a country is trying to open their economy. And the last slide that I have, sorry, I lost my spot. Okay, there we go. How well has it been implemented? It was not implemented well because Nigeria was so very late reporting the spreading. They lacked materials that they needed. What are some ongoing challenges? The fact that Nigeria only has one of the highest numbers of internally displaced people in the world. And the lockdown measures are increasing the demand of food in camps. So, what can we learn from Nigeria, from their response? We can learn that the citizens trust in the government. They do trust their government. We can see as a body that is large, many are struggling from COVID. I think we can all say that we've, in a way, struggled by this virus that has been being spread, especially the low-income countries, and I'm sure that people are struggling more than we are in the USA. And then our last two slides of our presentation are just our works cited, and we sure did have a lot of websites to cite. But that is our presentation. Thank you very much. I learned a lot during this. I had a good time. Thank you very much.